Welcome back. Now, multiple sclerosis, known in short as MS, is a chronic neurological disease that affects the brain and the spinal cord. Now, symptoms of MS vary from person to person and depend on the location and severity of the nerve fiber damage. Now, joining us this morning with more details about the disease is the founder of MS Namibia, Bianca, as well as Annthadine O-Oyefeso, who is an organizational development and movement building manager at OD. Now, thank you so much, ladies, for making time to speak to us this morning.
Good morning.
Good morning.
Thank you so much.
We could be asking, where are the men?
The future is female, they say.
The future is female.
And in Namibia, it's real.
The Namibia is real. Okay. Madam Bianca, perhaps let's start with you, maybe asking the question, MMS. Who gets MMS? Can anyone get it?
Yes, thank you so much for the question. Before I explain who gets MS, I think it is important that we understand what is MS. So MS is short for multiple sclerosis, which is a chronic neurological disorder that affects the central nervous system, which is made up of the brain and the spinal cord. So what happens when a person has MS is the nerve fibers are being disrupted or inflamed, which means the myelin sheath, which is the protective covering of these nerve fibers, are broken down, which results into the messages not being sent through from the brain to the rest of the body, which gives signals to function and to operate and to move. And that is basically what MS is. So if we look at the symptoms of MS, the very common ones are fatigue, optic neuritis, blurred speech as well, problems swallowing, sometimes depression as well. So because these symptoms are so common, it will take some time for a doctor to actually diagnose you with multiple sclerosis. That is why so much confusion also comes in, and that's why multiple sclerosis is a very complex neurological disorder. So to get back to your question, anybody every week can get multiple sclerosis, although it is more common in women. In fact, in Namibia, we have a 70% of MSers are women. But children also get MS, and around the globe, every 5 minutes, somebody is diagnosed with multiple sclerosis.
That statistics sound scary. I mean, what are the statistics in terms of Namibia, perhaps?
In Namibia, we have on our database, we have a very minority figure, which is around about 60 people. But we believe there should be more out there if we work on the global rate, which is 0.00% of the total population. We estimate there should be around about 3,000 Namibians suffering from MS.
Okay, so I might be wondering, is that an okay process to use an international concept to fit it to the circumstance of Namibia?
Yes, I think so, and that is why we have MSIF in Namibia from the UK, also to support us with this and to guide us into more resources and more knowledge and more guidance on how to do proper diagnosis, get all the data correct, and to do more awareness and research.
Okay. Madam O-Oyefeso, talking about this, getting the data correct, it is our understanding that MS is more prevalent in other regions, especially that are far away from the equator, and including that is North America, Europe, and Australia, but most unlikely on the African continent. Why is this the case?
Well, there's a I would say a myth or a suggestion that most people who live far away from equator tend to get it because of environmental issues, lifestyle, lack of vitamin D, but that's just not the case. We just have lack of data to prove that there is MS across the globe. Anyone can get it, as Bianca has said, and it's a young person's disease. Most people who do get it are between the ages of 20 and 40. So I think it's just a lack of research, a lack of funding, a lack of understanding with neurologists who are unable to diagnose people quickly, and also a lack of access to the necessary machinery like CT machines or MRI machines, which helps to improve the rates and to improve the number of diagnoses in Africa.
So in terms of the findings that you have, if I'm getting it correctly, is that, it appears is it because it's recorded most, for instance, in North Africa, North America, pardon me, is it because of research, Europe and Australia as compared to the African continent, perhaps?
I think it's just to do with a number of neurologists or resources funding that's available within those areas. And sadly, we just don't have the same level of funding and resources in Africa. I'm from African descent, so I feel like I can speak quite confidently on what we sadly don't have in this region. So that's why organisational bodies like MSIF are so important, because we connect the dots between MS organisations across the globe to share information, to share data, so that we can improve the diagnosis rates and can improve the number figures to help people with MS in Africa.
Okay. Madam Ozcan, let's talk about the underreporting that she's alluding to perhaps on the African continent. Is this a major issue for the continent, and perhaps what are the reasons for these challenges, for instance, besides the lack of access to equipment, this disparity in terms of health services? We've seen it even during the issue of COVID-19. Some sort of call it COVID apartheid, restrictions in terms of access. But what seems to be the causes of underreporting in Africa?
Yeah, thank you so much for this question, because this is one of the biggest challenges we face, and that's why we do not have the correct data in terms of numbers. Definitely the first challenge would be access to resources. That includes, number one, funding, and then also adequate training for medical professionals, because we find it that so often misdiagnosis or incorrect diagnosis takes place because there's not enough training being given to our African region and our doctors to do accurate diagnosis. And then obviously also the tools that comes with it, like Annthadine has mentioned, the MRI, scanning machines, the CT scans. And then for Africa is also the distance. And what I experienced personally within Namibia, we have a very big country, although we have a small population. But to refer a patient from Katima Malilo to Windhoek is time consuming, and it's very costly. And because MS is such a complex illness, it requires expert knowledge and supervision to make the patient feel comfortable at the same time, and to get the correct data, and obviously to put the patient on the right treatment. So we are suffering in Namibia because, number one, we do not have the funding to urgently, immediately get the patient to the right neurologist, because preferably a patient or a person should be diagnosed by a neurologist. And it's not always possible to get that quick access to the right center at the right time, to save everybody and, to look for a correct diagnosis.
So access is very, very, very important.
Yes.
Perhaps, Madam Oyefeso, MS is considered a rare neurological disorder among African population. This is obviously despite the fact that you're talking about more research needs to be done, especially based on African countries. It's ongoing. Is this a fair statement, or is this still maybe stereotyping or assumptions again that we are making?
I think it's a bit of both.
Okay.
I think it's rare and uncommon because that's what the figures say. But it's an unfair statement because we just don't have the resources. We don't have the neurologists to diagnose. So if we had more neurologists, then the numbers will be a bit more balanced. I think that's just it. It's a lack of resources, the lack of access to medical professionals who need to do the necessary steps before we can get the numbers to balance the true amount of MS patients who are in Africa.
So you disregard the statement that said there is a link between MS and ethnicity?
Yes.
Okay.
Everybody can get it.
Everybody can get it.
Everyone can get it.
Nobody's sadly immune from it. As I said before, it's a young person's disease, 20 to 40, and even in Namibia itself, 70% of people who have MS are women. So nobody's immune to it. So I don't think any race, ethnicity, gender is immune to getting disease, the MS. So it's important that we stay aware and we stay, fully equipped to what MS is, so we can look out for the symptoms and connect with organisations like MS Namibia.
Okay. Madam Ozcan, let's talk about the fact that the Multiple Sclerosis International Federation, MSFIF, you are a global body for MS, and what is your organisation specifically doing in Namibia to contribute to achieve the goals and objective of MS Namibia?
First of all, we are raising awareness because we need to get those numbers. Otherwise, we can't help those suffering. And it is very crucial and brutal to know that somebody has MS, but the person is misdiagnosed. And obviously, if you're misdiagnosed, you're going on to wrong treatment. So what we do in Namibia is we put a lot of emphasis on advocacy and awareness and patient support. That those are our 3 pillars for basically our objectives. And very much thankful to MSIF, the global umbrella body, that guides us and that makes things much easier for us. For example, they link us and they connect us with top neurologists across the globe. And they design the necessary toolkits and stuff that we can share during days like World MS Day, which is the 30th of May coming up. Because we don't always have the funding to do all these things. So we can basically just go and download something and customize it for Namibia. And that makes it so much easier. But we are here really to also assist the Ministry of Health and Social Services because as a patient organization, our focus is multiple sclerosis. And we can take that burden off the Ministry of Health to connect with the patients and provide that essential services that they need.
Okay. You mentioned the fact that you estimate that we have approximately 60 people living with MS in Namibia.
Yes.
You're talking about the importance of trying to get these numbers, but maybe a question that would be quite interesting is why do we want these numbers if we don't have the resource to attend to these people?
Because once we have these numbers, we can find the right connections to get these people diagnosed and treated. It is really, really crucial. There is help out there in the world. We are so thankful. And it's so important that we focus on awareness and the right diagnosis.
You want to add to that? Yes.
Yes, I do want to add to that. So at MSIF, one of our strategic goals is a stronger, broader MS movement. So that's one of the reasons why we're here in Namibia now, to connect with MS Namibia, to learn more about the landscape of MS within the country as well. So why numbers are so important is, as Bianca said, if we have numbers, we're able to connect them with the other MS organisations across the globe so that they can provide support. And as an MS movement ourselves, we're able to support the organisation in capacity building and developing policies, the necessary steps that they need to reach out to more and more patients across the country.
Okay. Talking about that, the global theme for MS, we understand, is navigating MS together. And with your visit to Namibia and talking about navigating these journeys, what have you learned so far, and what are some of those shortcomings besides not having adequate data? You know, what are some of those challenges that you have also identified? How are you going to, overcome those challenges from your recommendation and observations, and possibly seeing how you can harness opportunities like you're indicating with international organizations to ensure that it deserves the attention that it gets?
Absolutely, that's a great question. So we have worked with different regions across the globe. We've worked with Middle East, North Africa, we've worked with Latin America, we've worked with Asia, and we've gathered so many learnings from working with those collective organizations. And from those learnings, that's something that we want to also try and adapt and change and mix with what the knowledge that we've learned while we've been here as well. We've learned about the people have a heart for people. And even with MS Namibia, we've seen the need for the support from MSIF to keep reaching out to more and more people. So with our learnings that we've learned across the globe, that's what we want to adapt with our learnings that we've learned in Namibia, within South Africa and across Africa, so that we can increase and can make a difference in Africa as well.
Okay. Well, ladies, thank you so much for making time to speak to us this morning. Unfortunately, we're out of time, but we wish you all the best.
Thank you so much for having us.
Okay. Now, that was Bianca Ozcan, who is a founder of Multiple Sclerosis Namibia, as well as Annthadine O-Oyefeso. That's from the Organisational Development and Movement Building Manager, that's Multiple Sclerosis Namibia, talking to us about Multiple Sclerosis Namibia, which is a chronic neurological disease that affects the brain and spinal cord. Symptoms of MS vary from person to person and depend on the location and severity of the nerve fibre damage. Stay tuned as we continue more conversations after this break.